So our client for our prescription 4 is going to be Josie. Josie is a 65-year-old female with type 2 diabetes along with heart failure. She also has rheumatoid arthritis and complains about having lower back pain. All definitely different types of risk factors, stratification, signs, and symptoms of a lot of different metabolic diseases, cardiovascular disease, and so forth. First and foremost, I would obviously start off with Josie having to fill out her Part Q along with her pre-participation health screening, certainly with a medical professional. I would ask for her full medical history, provided that we actually did already get that. And then after that, I would definitely take some time to talk to Josie about her signs and symptoms that she's containing and has, and talk about kind of her little daily living and what she's doing and so forth, and how we can make some positive changes. Provided that she does have type 2 diabetes, we're going to have to ensure that we're keeping a close eye on her hypertension, blood pressure, and then along with her heart rate and so forth. A lot of her CVD factors include her age, being over 65, her HbA1c is at a 7%, which clearly shows that she has her type 2 diabetes, provided that it's over 6.5%. Her family history is something to take into consideration. Hypertension, her blood pressure is 156/95, which is insane. She also has dyslipidemia because her total cholesterol level is over 200 at 210, and she probably has low physical activity or very sedentary lifestyle behaviors due to her lower back pain, since we know that kind of inhibits people from actually being physically active. She does have heart failure, which is going to be a sign and symptom indicating of her cardiovascular disease. She also has a BMI of 30.0, which is putting her at a risk factor for metabolic disease, provided that she's obese. We do most certainly need medical clearance due to all of the signs and symptoms and risk stratifications that Josie has. Medical exam would absolutely be conducted. When she does the medical exam, I would ask for her to also get an EKG to ensure that the heart is going to be able to handle any type of activity, first and foremost, and then what type. But then also, I would probably suggest a DEXA scan if at all possible, provided she is 65, she's going to be postmenopausal, her bone density is already going to be depleting, let alone she has the rheumatoid arthritis. So all different factors just to make sure that we know everything about Josie. I would do some baseline testing in order to ensure that we are treating her appropriately. We're focusing on cardiovascular fitness, her overall flexibility. We want to make sure that her functionality increases, and we also want to focus on her strength. With that being said, we want to do a body composition test. We already do we can figure out her BMI. We want to make sure that we're on the right track with that, but we want to figure out what her fat percentage is and where it's located, provided that if there's more visceral fat in the abdominal area, it's going to increase her CVD risk factors exponentially. Therefore, we want to be able to know those girth measurements so that we can use that as a baseline measurement and then be able to compare it to ensure that she is actually progressing in the which way she should. We are going to hopefully aim for a 5 to 10% decrease in her body weight to help kind of combat that. Medical supervision during her exercises especially is going to be highly recommended, provided she has heart failure. That is something very serious. Hypertension along with her diabetes is going to be super serious too as a combination, so we want to make sure that she's not going over any exertion. Anything over 13 on our RPE scale, provided that she's 65 and probably shouldn't be participating in maximal exercise. We're going to do the RPE, keep everything under 13, and ensure that we don't exasperate our client. After we establish her blood pressure, her heart rate max is obviously going to be a little bit over 160, but again, we're going to focus on the RPE scale to ensure that she is going to be appropriately treated. We also want to, for muscular strength and endurance, in order to check a baseline, because we don't want to be doing any 1-rep maxes with her, I would probably do a hand grip strength test. If that wasn't anything that was going to show a reliable numbers, I would do an isokinetic dynamometers with back attachments to assess strength so that we can alleviate the back pain, and she's not going to be feeling that. Along with muscular strength and endurance, if she can swim, which I'm hoping she can because she's part of my prescription, I would be modifying the strength and resistance portion of her prescription to swimming, ensuring that there's no weight-bearing exercises going on, even body weight at this point, since we don't know where she stands and we don't know her range of motion that we'll test in just a little bit. We want to make sure to not exasperate her. All the tests are pretty simple, so the baselines will be able to show us where she stands, and they'll be simple to perform for us once she has medical supervision for her follow-ups. Her flexibility needs to be tested, I believe, with probably not a sit-down sit and reach, but more so like sit in a chair sit and reach, provided her lower back pain. We don't want to exasperate her too much. If that was going to be a little bit too much for her and her comfortability, I would establish a range of motion for her larger joints using a goniometer, provided that her age and her arthritis. We don't know how much that's limiting her range of motion, and we want to make sure that we're not causing her any type of discomfort so that she can not only perform all the exercises but adhere to them when she's doing them on her own, moving forward after the 6 months, of course. Then we're going to do cardiovascular endurance. There's obviously absolutely no way she should be doing a maximal test. We're going to do a sub-max test. I'd like to do the Rockport 1 mile test. If that is going to be a little bit too much for her joints and so forth, because it is a walking test, we can definitely move into the cycloergometer, which actually I will show you in a second. She will do cycloergometry sub-max test just to see if that would be a little bit better. Not always as reliable, but still better than nothing. As far as her neuromotor, she's definitely going to be sedentary and low physical activity, so her proprioception is just going to increase just by the small amount of physical activity that she starts to participate in. First and foremost, she'll be walking as soon as we can establish that her bones and range of joints, range of motion is going to be capable of doing that. After I implement walking a little bit and somewhat of swimming for resistance, strength, and endurance, I'm going to transition into some yoga. Yoga, I believe, is going to be able to take all the components and put them in together. It's going to increase her neuromotor stuff. It's going to increase her flexibility and just tie things together. And then Tai Chi, we're going to also work on for her stability. So that was going to take care of the neuromotor aspect. I would actually prefer her to do a few Tai Chi motions, a few yoga poses which are pretty simple, so we can just kind of establish a baseline of how her stability is, her balance is. She is a little bit older, so we're definitely focusing on that. We want to make sure that we are all for injury prevention, because she can definitely more prone to breaking all those bones because of her bone mineral density at the age which she's at. Some precautions that which we have to take into consideration necessarily, of course, is going to be first and foremost her heart failure that she exudes and her overweight are going to be huge precautions, and her hypertension along with her type 2 diabetes. Type 2 diabetes, we're going to take the precaution by actually monitoring beginning of the exercise, in the middle of the exercise, and after. We're also going to take a few precautions and ensure that we have a few different types of soft drinks to be able to elevate her blood sugar if it drops too low or anything like that. Water, of course, necessary in moving forward. We also are going to want to seek some guidance for her habits. We are not able to give her any type of recommendations on what to, any type of requirements on what to do, what to eat. However, we can definitely recommend her to see a dietitian, let her know that she should probably educate herself on her nutritional needs, provided she has type 2 diabetes, she is overweight, and her heart is failing. We want to make sure that those arteries get back opened up with our cardio that we're going to be doing with her, and we want to make sure that she's not making poor life choices like smoking or consuming too much alcohol at that age. My grandma does, so we got to make sure she's good to go. Her limitations are most certainly going to be the hypertension and any type of lower back pain that she is experiencing, along with that rheumatoid arthritis, provided that's going to give her a limited range of motion in the joints that which are giving her problems. And then provided that we just get older, it's going to just be getting worse. But if we can implement some good habits for her now within these next 6 months, maybe we'll be able to definitely probably not combat things like that, but we'll be able to at least deter them from progressing at a high rate. Ideally, for my overall goal for cardiovascular, I would like to increase her physical activity naturally, because I'm saying she's going to have like low sedentary tendencies. We want to make sure that there's no pain while she's walking. We want to make sure that she does some water aerobics, increases the heart rate. That's going to increase your strength and endurance within her muscles as well, providing there's going to be some form of resistance from the water and just natural fluid biomechanics. We want to increase her oxygen uptake. This will actually decrease her blood adhesiveness, which is going to allow for us to have a positive effect on her blood viscosity and hopefully open up those arteries, provided that heart failure is obviously coming from somewhere. We also want to ensure that we are reducing her blood pressure by 5 to 7 diastolic and systolic measurements, provided that that's going to help us combat some of those cardiovascular risks that she has. Definitely, we're going to focus on cycloergometry. We don't want her walking just yet. We want to make sure that she can do it. And then we're going to transition into the elliptical. We're going to transition then into walking every single day. And then after that, I want to ensure that we can combat her type 2 diabetes and improve her insulin sensitivities. In order to lower her cholesterol concentration, we're going to implement that art cardio, the yoga, the tai chi, all of it all together is going to be a little bit of endurance. It's going to help raise her HDLs, which will overall make a blood concentration level a more of a positive risk factor for her CVD. Her strength goals, like I said before, are going to be not necessarily, it's going to be minimal resistance activities. Swimming is going to be probably to the extent of which I do. The only thing I was thinking is possibly towards the end of the 6 months, maybe do a calisthenic little program, definitely of low intensity, not a class that's provided at the YMCA, because those women are pretty intense. But we do want to be making sure that everything about her is strengthening. Flexibility, ideally, I would want her to wake up every single morning with a flexibility plan, along with, that includes 10 to 15 minutes, minimal exercises. She could even start off with sitting stretches, arms across her chest, pulling her knee up to her leg if that range of motion is available there after the baseline is tested. She can even just bend over and try to touch her toes sitting. We don't want her to exacerbate herself. We want her to be stretching all of those different body components and ensuring that she's not only increasing her flexibility, but preventing those injuries from happening. Ideally, for the first 2 weeks, all I would like Josie to do is start learning exercises. She's obviously going to be a beginner. We're going to have to be teaching her form. Form is going to be key for everything. We want to make sure that we teach her that her arm circles are going to go all the way up by her ears and all the way around town. And then after that, we're going to do leg circles and sitting stretches. For the 4 weeks progression, I want to increase it from 2 times a week to 3 times a week, still sitting stretches, but we want to make sure that now she's doing it